And I think we get silence, so let's deepen that for our moment of silence before we get into our agenda. Thank you. Two quick things before we really get into it. One is we had a request last time that we tried to make things more readable on the screen, so we've got a trial this time. And when we get to the end, I want you to let me know whether it worked or it didn't, and then we'll see where we go from there. The other thing is, as usual, we've got a full agenda. And Adam's on the agenda last, not because his topic is the least important, but because it's likely to need the most time. So we're going to let staff and residents get their reports done first. And we may violate the general 1 hour rule and stay past 11. We'll see how long it takes. If it looks like it's going to take a really long time, we'll stop and schedule a follow-up meeting. Because he really wants everyone to have their concerns heard and their questions answered. And he's also willing to do individual meetings if that works for people. Okay, first item is introduction of new residents. And she isn't super new, but she's new since the last Resident Association meeting. Ms. Sally Wyatt here this morning. Stand up and wave. Person comes to do it. Oh, Lexington people here. And then next, Alicia. Yes. Is it on?
Can you hear me?
Yes.
Great. Good morning, everyone. Thank you all for coming. This is a packed house, and I'm thrilled you are all here. Got a few things I want to go through. I'm going to go through them fairly quickly because, as we mentioned, we do have a full agenda. The first thing I just want to mention, you all got the email, and Adam and his team will be addressing the survey of the board center, but I did want to just mention about the advocate. And there's been some concerns with residents that we had not been transparent about the survey in the board center. I know staff knew, I know the board knew. I don't go to every residents association meeting, but I know Jan was typically very transparent. And so I wonder if it was mentioned, folks just didn't maybe understand the implications of it. What we can do is going forward is maybe develop that type of protocol that when something like the surveys there, that we can emphasize it even more. We did not know what the results of those surveys would be in terms of the star rating until I announced that at the December meeting. I think we got that rating, I don't know, a week or two before that. I'm not sure. So I apologize for that. Going forward, we'll be make sure that folks understand that, if that makes sense. Other things, I think you did get the email that we do have a new culinary individual starting, Jennifer Hickey. She's coming starting next Monday on the 27th. I will bring her to the Residents Association meeting next month for you to meet her, but she is just seems like a very kind person, understands customer service. I think you'll see her in the dining room, so feel free before the next meeting to introduce yourself. So that's one thing. Also, as I have you've heard and seen in one of my emails, we are looking for a marketing director. Interviews will probably start within a week on those first round of interviews to kind of screen it before we move on with that. Next thing, Doug Hellman, our kind of transitional leader from TKC, is going to come down starting next week, and he's going to come kind of once, twice a month for 4 days to kind of just assist with everything that I'm doing and to be a resource for us. So Doug Hellman will be here, and there again, I've asked him to come to conversation. So if you want to meet him right away, come to conversation. Temporary assistance for the accounting department. I have engaged an accounting firm, a CPA firm out of Buffalo, New York. Coming from, we did interview a couple of places. This was a recommendation from the local hospice that they use them for accounting, CFO, controller services. So I'm going to have a little assistance in the accounting department over the next few months to get through all the reporting and the audit and all that kind of stuff.
Name of the firm?
The name of the firm, Freed Maddox. So I was very impressed with what they got in terms of their security and what they can do for us. And they also have folks with CCRC experience. So that's going to be, I didn't want to hire someone that I had to do a bunch of training. That was going to suffice. So that'll help out. And then I think Jeff will send something out, but just for the folks on Sunrise Bridge, we're continuing with that, fixing that fiber optic. There's one more piece of it that they discovered. They couldn't start this week with all the cold, but we anticipate getting that hopefully corrected within the next few weeks. I know that was fast. Any quickie questions before we move on? Okay, thank you.
Good morning. I'm Pam Lucky, and I'm the board chair, and I'm here to give you an update on our search for a new CEO. So when I spoke to you at the November meeting, we had yet to form a search committee. We have done that. We did that in early December, and despite the holidays, we've already met 4 times officially and had other conversations and Zoom meetings as well. And I want to tell you, this is a fully engaged committee. Every member has attended every meeting, and that includes Vassar Bird, the CEO of TKC. The other members of the committee are, in addition to myself and Vassar, Doug Hellman, and then locally, Dennis Cropper, Bill Craig, Karen Russell, Elizabeth Brenner, and Randolph Hare. So what have we been doing? We've spent much of our time crafting a new CEO job description to reflect what we all agree is needed today. More than 100 residents, staff, and board members completed an online questionnaire that was sent out in December, and you gave us input, and we greatly appreciate that information. Although many of you expressed a willingness to be included in follow-up interviews, we've concluded that that wasn't necessary. The message we received from all 3 groups was clear and consistent. So we've also reviewed the job descriptions of 3 Kendall affiliates that have recently conducted searches, just to get a little comparison. And we are nearly done with this new job description. So our plan is to share it with you later this month. This document will guide us as we begin to evaluate candidates and ensure that we are focused on the most important qualities. At the same time that we've been doing this, the TK staff and our own staff have been preparing additional materials that will be part of the packet we send to applicants. And we want to make sure our website and our social media presence are updated and ready for lots of new visitors to come. And this team includes Jessica Bueller, who many of you remember was our marketing director. She's now in a similar role at TKC. And in addition to being a lovely writer, Jessica knows the beauty and the attractions of the Shenandoah Valley, and she will help us prepare material that really sells people on coming to join us on this beautiful campus. So what's next? We hope by January 31st to begin casting the net for candidates. The hiring process today, I have to tell you, is very different than when I was hiring journalists back in my newspaper days or when I was looking for professors when I was working at Washington and Lee. It's probably a lot different from when you all were hiring too. We will be using online job sites such as Indeed.com and social media platforms such as LinkedIn. As far as I know, there are no plans to use TikTok. Okay, in addition to this, the TKC staff will also be disseminating the job ad to their extensive industry contacts and also through the trade association Leading Age. And we're hoping that collectively these efforts will bring us a very qualified pool. The TKC staff tell us to expect applications to begin arriving quickly. And Kim Dunn, who is one of the TKC veteran HR staff members, will conduct the first screen. And then she will pass along to the search committee a pool of qualified candidates whom we will begin interviewing by Zoom in February. So we hope to distill that group to 2 or 3 finalists to invite to campus, possibly as early as March. And residents, staff, and board members will all have a chance to interact with the candidates during those visits. Each one will be here for a full day. And then we will we'll come up with some way for you to formally let us know what you thought of the candidates. And remember, while we are evaluating the candidates, they will be evaluating us. So I ask for your help in making the candidates feel welcome. I'm not going to ask what you're like. So then the next step will be the search committee will make its recommendation to the full board, who will select the new CEO and will offer him or her the job. So that's it. It's probably not going to be quite as linear as I described, but that's our plan. Happy to take questions. And you know the names of the residents who are on the search committee. They're happy to take questions too in one-on-one conversations. Okay, thank you.
Good morning. All right, so for marketing, first and foremost, a big thank you to all of our Kindle Trailblazers. If you all missed that last week, there's a video available online, so we can send you a link for that. And a big thank you to Kevin for moderating. He did a great job. The next event for our 25th anniversary will be here in Kindle Hall, Tuesday, February 18th, and it's the Kindle Singers at 4 p.m. And for the marketing update, we have 6 reservations so far for 2025. We're really kicking off the year strong. Tomorrow, Diane Reitmeyer moves into apartment 204. We have other move-ins scheduled for February, March, April, and 2 in May already. We remain at 100% occupied. This is our 6th consecutive month.
Since the last RA meeting on November 20th, Sarah and I have had 11 tours, tryouts, and meetings with folks from the following places: California, Putney, Vermont, Neptune City, New Jersey, Welford, South Carolina, Monroe, Virginia, Charlottesville, Virginia, Salem, Virginia, and 4 different prospects from Lexington, Virginia. We finished 2024 with 57 new waitlist members added for the year. Our goal was 30. And we've added 1 so far in January, which is typically our slowest month of the year for tours. And believe me, it's been slow. But that allows us to keep up with other things like all the paperwork required to move in all these new residents who've already reserved and have scheduled move-in dates with us. So we currently have 214 waitlist members, couples and singles, 62 of which are ready now. That's it for marketing. I think Todd's up next.
All right, good morning. I am going to spend, I'm not going to go down my usual list of a million projects going on. I'm just going to hit some of the big highlights. Next meeting, I will have my full 2024 review where I do all my charts and graphs and laser pointer and everything to show you some numbers and things. But I want to hit some big projects, including some open 2024 projects today. The fitness flooring project that was supposed to be finished in December did not arrive in time. They promised me it'll be here by the end of January. That's about a week, so I'm not holding my breath, but we'll see. It's paid for and coming as soon as it actually shows up. Same for our new Kendall Hall curtain. You notice this is not a new Kendall Hall curtain behind me. That was committed for mid-December. Now they say be soon. So we'll have a curtain sometime, I hope. Elevator number 2, which we bought the parts in January of 2023. Nothing is scheduled yet. They just stall us every time we talk to them. Elevator number 3 has had some pretty serious problems in the last 36 hours or so. The tech was here. It needs some minor parts. Those parts are available. He is coming back today to put those in, and that one should be fixed by us close of business today. The Sunnyside new HVAC system is designed, funded, and approved. Train will be here tomorrow to work on a deconfliction and scheduling meeting with me to get that project moving as well. The new roof for Sunnyside is not yet designed. There were several options proposed. There was a lot of discussion on that. So we're still evaluating the feedback and kind of back to the drawing board on what the roof should look like for the design over there. Johnson Controls is working with us on some fire alarms. We had, starting at 1 o'clock this morning, lots of us got phone calls or loud noises in our bedrooms. It was failed components, physical hardware components in that system had failed. We disconnected them this morning and did what we could, but we can't clear and reset the system. That tech is supposed to be here today for emergency repair of that. The south entrance door, it's kind of like an obstacle course. It likes to open and close and things like that. We've been doing that for a few days. That tech is supposed to be here tomorrow to look at that as well. So a couple things that you may have noticed depending where you are out and about campus, those are all in the works. What I want to spend most of my time talking about, even though it really doesn't affect every single person here, it affects a lot of our community, is the heating and air conditioning system. We probably don't care about the air conditioning. The heating system that was put in about 4 years ago, the VRF variable refrigerant flow system that's in the north and south apartments primarily. We've had a lot of problems with that. The system, as it's designed and installed, it can freeze up when it's in normal heating mode. Those units don't have and cannot have defrosters in them. So when they're doing normal heating support to those apartments and the coils freeze up, how the unit protects itself is it starts heating the unit, and it has to get rid of that excess cool somewhere. So it randomly picks on one of the apartments that it's connected to and it air conditions that apartment. That's terrible. That's what the hardware that was put in does. When it gets down to 20 degrees outside, the units completely shut off to protect themselves. They cannot operate in low temperatures with the refrigerant and the design that was put in there. There is not resistance strips. A lot of us who had the older style heat pumps remember the electrical resistance strips. These are basically the equivalent of the old baseboard style heaters were put in there. These units don't have them, and they cannot be added retroactively. And the units that were put in are no longer made and supported by the manufacturer. So that's kind of the past. Where we are on the present is if you're in one of those affected apartments, we've gone out and got a lot of space heaters and made them available. Most folks have one, some folks took 2. Some folks are from places where it's cold and didn't want any, but we've made them available and we bought extras and I have extras. So if what we've done is insufficient or you change your mind, just please come tell us. We did keep a pool of other ones just so we'd be able to respond if there were any issues on it. I said some not very nice words to Johnson Controls about all this and said, what can I do to fix it? Not much. The only solution they said was you can put a tent over the outdoor condensing units and put a propane heater in the tent to keep the units warm so they work. We're not going to do that. That's a huge violation of fire code and everything else, and that is ridiculous that their tech suggested that. So the way forward is a competitor of Johnson Controls will be here tomorrow. I'm going to show them those units. They know about them. They already have the drawings, and we've talked about them before. So can you do anything to make these work right? And if not, give me a quote to figure out a way forward. So we know it's a problem. I've done everything I can think of and some other terrible ideas we would have. And we'll keep you posted what we come up. Okay, so that was my list for today, barring any questions from you.
What is the effect of using the space heaters on our electric bill on the ration?
The question was, what is the effect of using the space heaters on our peak system that we've done? It undid the last 2 years worth of work. We set a new all-time high electrical peak due to the winter space heaters. Normally, we set all-time highs in the summer, in August, from air conditioning. We blew our 2 years of conservation trends trying to do it. Yes, sir.
Is the heating system at Sunnyside House covered by what you've talked about here, or is that a separate problem?
The question was, the heating system at Sunnyside isn't affected. I'll give you 2 parts to an answer to that. It's a completely separate system that doesn't suffer. It's not this type of hardware. It is not tied into this. It is being replaced simply due to age and obsolescence, and the fact that the bedrooms upstairs share a single unit. So one room cannot have a different temperature or heating or cooling compared to the room next to them. And that causes us endless problems. I mean, you can imagine if you go to a hotel and the person in the room next to you gets to decide how hot or cold your room is, you won't get, not a great hotel, right? So we're fixing that. I'm adding 2 additional zones. Every room in the new system will have its own unit that supports it. Those are units sold by Trane, not Johnson Controls. They will work in temperatures down to below 0, and they're using modern equipment, modern refrigerators. So it's not affected now, and the new one's going to be better. Yes, ma'am.
How many units in the south and north building are affected? Is it all?
Question was how many units in the south and north are affected? I don't know the exact number off the top of my head. I will tell you the problem is worse on the north than on the south, because when those outdoor units run, they're putting heat into the apartment. They have basically cold rejection temperatures that have to go outside. They blow it on each other. So when one is working, it's blowing cold air onto the unit next to it, and it just makes the whole system feedback a lot worse. Yes, and primarily that seems to affect the 3rd floor the most. And it's just, I think it's happenstance of where the units, outdoor units, were sited and how they were connected. Yes, ma'am.
I want to thank you for all the hard work you do, because what you're doing is a big problem and it's difficult. And I appreciate it, and I thank everybody else.
The Johnson Controls folks were a little less kind in our conversation, so it would end on a positive note. Thank you. Right, anything wrong?
I live on the 3rd floor. I don't mind sleeping at 60-degree temperature, but when I get up, I do like a little heat. I do have 2 space heaters. Thank you for providing me for that. Unfortunately, it doesn't heat my whole apartment. But anyway, I'm getting used to it. I think they should buy me sweaters now. The winter. Anyway, I am currently the convener of the Culture and Entertainment Committee, one of the hardest working committees we have. And the first thing I want to do is I want to thank Diane Herrick for leading that committee for the past 2 years. I think she did an outstanding job along with her committee members. They're the ones who plan all the activities that we have each month, the lectures, the outings, the concerts, everything that goes on with that committee that plans it all and executes it. And I think Diane and her committee did an excellent job, and I commend them for the last 2 years of their work. Members have decided to stay on and to serve in the committee that I am now heading. So I hope you'll be able to continue with the work that Diane has done the last 2 years. Now, I have there's a C&E bulletin board, which I'm trying to organize, and I keep close tabs on that. And I will make sure that nobody puts anything on that bulletin board that I haven't approved. Now, please do not just put anything on that bulletin board that doesn't pertain to C&E. What I've done is I've posted the January and the February calendar for your benefit, and there's 5 different for bus sign-up sheets, and we'll continue to keep those in order. So now we're already working on the February schedule, and so we'll continue doing that. So you know what's coming in February and the few things we have left in January. And of course, here on the 22nd of January, the next big thing is the the live streaming of the Aida Opera here in Kendall Hall. It's on a Saturday because that is when it appears at the Metropolitan, actually is a live performance of Aida on this coming Saturday. And the next big thing is we have a Drifters concert. This is down in Clifton Forge at the Masonic Theater. And I have a full busload for that. Although there's 2 people who still owe me money. So if you're one of the 2 people, I don't want to name you, but there's 2 people who haven't given me their money. So I'm looking for you right after this meeting. But we have a bus for that, and so that should be a good trip. The Drifters, it says the original Drifters. I think there's 4 of them. I think there's only 1 that's from the original group, but that should be a good program. And then in February, I'm not going to go through the whole list in February, but we have a Boris Borman, the pianist, will be on the 1st February on Saturday, and that's in Washington Lee at Kendall Hall. And then we have an Al Carlson Memorial Concert done on Garth Newell, will be here on Sunday, the 2nd. And then the King Sisters on the 7th, also at Washington Lee. So all the sign-up sheets are there. When you do the sign-up sheet, not only does sign your name, but look at the information that's there, because sometimes we have to purchase tickets. And if we have to purchase tickets, it's up to you to purchase your own ticket. We do not go and buy a group of tickets for everybody to sign up on the list. So you can either do it by online or you go in person to the ticket office and purchase your tickets. So if you're going to sign up for one of these concerts that requires a ticket, please make sure you do get your ticket before you get on that bus, or hopefully they're still selling tickets when you get to Washington Lee. And anytime we have a sign-up sheet, we are looking for drivers. We only have 3 drivers, 2 of which are full-time, and then Lee is part-time. And so every time we have a sign-up sheet, we have to ask Karen to see if they can find a driver. And that's critical. If we don't have a driver, we don't have a bus, then everybody has to go out on their own. So just be aware of that. Occasionally we have to cancel because we don't have a driver. We're lucky that we've been able to get drivers for all the outside events that we've scheduled so far. The other criteria is that we need at least 7 people to sign up on the sign-up sheet. We will not have a bus if we have less than 7 people. So we did have to cancel a concert, the Martin Luther King concert, this past Sunday because we only had about 3 people sign up. That doesn't mean you can't go, you just have to go on your own. So just be aware of that when we have to cancel. That's the only reason why we cancel. There's no driver, or we don't have 7 people. Now, I have a very good working committee, the ones who have been working with Diane for the past 2 years. They'll continue working with me. But we need ideas from everybody else. Now, you all have been around. You all go to different restaurants. You go to different events. And so I need feedback from you when you learn about an event that's coming up, or you know somebody that could be a good lecturer for here in Kendall Hall, or you've been to a concert or a restaurant or whatever, please send me an email and just give me some information. Say this might be a good program we can have in Kendall Hall, or we can go out on a trip. So we need your feedback as well. I do get occasion. I've received a few emails already. Continue to feed me with your emails of information or ideas that you have that might be a good for Kendall Hall, because our committee of 12 cannot come up with all the ideas. We try to, but we rely on you as well. Anyway, I thank you for your support, and hopefully we'll have a very exciting year this coming, and thank you for your support. Thank you.
Good morning.
Good morning.
Well, I guess somebody has to follow Paul. I'm here with just a brief report about the Kendall College programming. I hope you know that the program on Great American Poets begins a week from this afternoon, 4:30 here in Kendall Hall. The first poet, Walt Whitman, will be presented by Edward Adams, a professor at Washington Lee in the English department. Then 2 weeks from this afternoon, Emily Dickinson will be presented by Mary Jo Salter. And 3 weeks from today, February 12th, Robert Frost will be presented by Rob Fury, who is recently retired from his 40-some years as the director of the Office of Lifelong Learning at Washington and Lee. And then we have a program coming up in March. Art Goldsmith, an outstanding professor of economics at Washington and Lee, will present a program on economics that gets into today's world and artificial intelligence. I'll have more to say about that in connections in the issue. Art will be here on March 5, 12, and 19. Speaking of Mary Jo Salter, who is here 2 weeks from today, several people had asked me about finding Mary Jo Salter, and there's a story to it. It's too long for today or when I introduce her in 2 weeks, but my idea was to write up the story and ask Ted Burroughs to print it in his pen and pixel, which he did in the most recent edition. So I hope you've gotten that. Called The Search for Mary Jo. One final note. It also is money, as Paul mentioned. I want to thank you for supporting Kendall College programming all these years. But please note and remember that there is a charge for the upcoming poetry series. As always, that charge is $10 per person for the entire 3-lecture series. You can't go to college and get 3 lectures for $10. I mention this because occasionally some folks attend, but have forgotten to pay the charge. We generally charge for each program series because we give our presenters a modest honorarium for all the hard work that they do in presenting what they do here. But occasionally, budget permitting, we're able to provide a series for no charge. When you see a flyer announcing the program, it will always tell you if the series requires a charge or not. Thank you very much.
Testing. Everybody can hear me? Great. Okay, so a lot of faces in the room today. I just want to briefly introduce myself. My name is Adam Feldbauer. I'm the nursing home administrator, the health services administrator. I'm responsible and oversee Borden Center and the Webster Center. Just quick facts about myself. I graduated from Indiana University with healthcare administration. Made my way into Virginia at Westminster Canterbury Lynchburg, was a department head, completed the administrator and training program, became a licensed nursing home administrator, went to Charlottesville, Virginia at Martha Jefferson House as the administrator and became the chief executive officer there, went back to Lynchburg and was the executive director at the Summit, where during that time achieved a master's degree in management of aging services. And effective today, actually, I'm a licensed preceptor, which means that I am licensed to have future administrators go through an administration and training program in preparation for their licensure examination. Now I see way in the back, I don't know, through the doors, a lot of health services team members. If you can see them and wave, these are the people that are, working either in Webster or Borden or both. day in and day out, ensuring, the care that our most vulnerable population at Kendall, receive. So, just want to do that introduction, just a little housekeeping. I would appreciate questions at the end. As Lee indicated, I'm more than willing to meet, at any time. I think I come to every single, independent living event that I'm asked to do. And, I'm more than willing to meet with you all one-on-one because it is a lot of information. It's very complicated. Some of us in the industry still, are trying to figure out, well, how they come up with that on a daily basis. So my intention here is to go high level because it is a lot of details information. But, I do understand, that people move into Kendall at Lexington for, the potential of needing health services. It is scary if it goes well. As I said, this is the most vulnerable population that we have in our health services field. And then when you see things that a survey did not go well or sounded, like it did not go well, that is scary. Fear of the unknown is perhaps one of the greatest fears. So my intention is to, at high level, explain what a survey is through specifically Borden, how we did or what happened at high level in the various surveys that we had, and then explain the star rating and briefly how that point worked. Now, what also we have is, so this is basically a 3-page summary of either what you either read in the Advocate or what is available online at CMS, Center for Medicare and Medicaid Services. The easiest way to find that is just type in CMS nursing home compare. You can find Kendall at Lexington. That's the details. This is a brief, what the issue was, how we responded. Kendall responded to CMS. And then also we added a third column, which won't find any of those two, are ongoing initiatives to ensure future compliance. Okay. So again, Stephanie Wright is gonna distribute this how she normally does, either via email or for those of you who need the printout, she can do those. But those are kind of more of the specifics. Again, if you have questions, I'm happy to meet with you. I'm easy to get a hold of. Either stop me in the hallways, the dining room. I have a mailbox at the front behind Karen. I'm located in the Borden administrative suite there. I'm happy to meet with you. Okay, so but first I want to just make it clear that Borden is in full compliance with CMS, again, the Center for Medicare and Medicaid Services, along with the Virginia Department of Health. We have been in full compliance effective July 23rd, 2024. So there's no ongoing issues, at this time. Just making that very clear. That was confirmed in an October 9th, 2024, which kind of speaks to the timeline, of how long perhaps we received feedback from the state. But I'll get into that. So I'm just jumping out there with that. Highlights that I think I'm, most proud of with our health services since April of 2024, even just kind of this time last year, we have a more stable healthcare leadership team. Improved onboarding for companions, that was certainly highlighted. We have food service enhancements, and that was even indicated in a separate inspection by a local health department, the Central Shenandoah Health District. They came and inspected all 5 kitchens, so that would be Anderson, Webster, Borden, and with only one minor issue that was fixed on site there. We've added call bell display monitors that you can see in Borden. If you go down the hall, there'll be a monitor behind the nurse's station, which essentially is a highlighted, like if room X 505, hit the button, it'll pop up there, so it's visual, so everybody can see it, which has helped response times. You may have seen, if you go into Borden or been there recently, a Borden welcome guidebook, which essentially has contact information, key information that we think really helps either A, family members visiting, or B, new residents coming in who don't know, the who, what, when. We've launched the Spices Spotlight newsletter, which has had 2 issues. It's available for independent living residents on the Katie website. And that's, the intention there is strictly just health services information, what's been going on, what we think is important to share. It's intended for residents and family members of Borden and Webster. However, we make it available through the Katy for independent living residents. I do like feedback because this is intended to be what you want to see on there. So it's just a nice way to have that communication. Charting has been completed by nurses in the hallway. You may have seen the little wheeled system now where the CNAs can get on the iPad that's on a mobile device versus having to go, around the corner if you're at 400 into the nurses station there, which has given better eyesight. Okay, so let's just jump into it. Why did the violations occur? And in a broad stroke, because all of these are specifics. Again, if you want specifics, what happened, how did we answer it? It's there. Again, I'm available to talk to you, but simply put, the issues arose from monitoring gaps and follow-up. Leadership monitoring gaps and frontline follow-up. I mean, it's that simple. Why were IL residents not informed of this? I mean, Felicia spoke briefly about that. You'll see throughout this presentation, the timeline with the state, and if you've worked with the state before, they're not, necessarily that worried about getting us the stuff as much as they are worried about us getting them the stuff. So, the delay in sharing is not intentional. Leadership needed to be timed to ensure updates were clear and accurate. Actions resolve we began resolved issues in April, but the CMS star rating changes were only available in December. The leadership, including CEO and board, stayed involved and helped guide resolutions. Okay, so assurances you can give about the actual quality of care. Again, the third column added on here kind of goes through specifics of what we're doing for ongoing monitoring and highlights our nursing leadership, director of nursing, assistant director of nursing, nursing manager, amongst others, conduct regular audits and staff retraining. We've enhanced our care planning documentation with our health services leadership team, which is that group of individuals, plus others such as our quality assurance manager, myself, MDS coordinator. We're conducting daily rounds to go into each room on 400 and 500 to do checks. We have significantly strengthened our quality assurance and performance improvements, the QAPI Committee for Infection Control. And again, I just mentioned the new communication tools of the Welcome Guide and Spotlight newsletter for ongoing communication. Okay, so for the advocate, how are we responding? In short, we're not going to respond to the advocate. Essentially, you'd have to write a letter to the editor, and our team, which included either board members or marketing or TKC or a crisis management consultant, all essentially said, the best way to respond is to just show that, on the next survey, we can do things on our own, like the Facebook post, but no intention to respond to the editor. Implications for marketing IL vacancies, especially in distant markets. All issues are not limited to the health center. So while the negative press from the Advocate article and the community CMS star rating of 2 stars may impact Kenneth Lexington's appeal in independent living markets, we're addressing these concerns transparently and emphasizing ongoing improvements will be critical. Marketing has received information again from that same crisis management, having ongoing conversations. So they're equipped with the tools to how to communicate with potential future IL residents regarding this. Impacts on Borden as an appealing place to work. So I mentioned the stabilization of healthcare leadership certainly helps. Addressing deficiencies with our leadership visibility, prioritizing staff engagement and retention are also key strategies. With that, Borden has began an on-shift engagement program, which on-shift is a scheduling tool that we added on the engagement platform, which essentially, if our team members are showing up on time, clocking out on time, they'll receive points, and essentially we can add in other points if they're doing things such as training another person, showing up there in inclement weather. It's kind of at the manager's discretion, but essentially it's only like an add-on points reward. So you're not going to be reduction of points for perhaps doing something wrong, but there will be rewards. So it's also it's to highlight who our top performers are and to give some sort of incentive for them to do the right thing, as I think we all strive to do. The lingering star may affect perception, locally. However, we hosted this past year during this inspection time, the Rockbridge Area High School CNA program, as well as the Mountain Gateway College program, which included employees of our own. And received tremendous feedback from the instructors and those going through the course. So I think we're going to be okay. In addition, a number of the nurses that left per se or went to PRN program, we're actually going to become RNs, and we're going to have a number of RNs hopefully coming in May once they're finishing the school program. So, can it have some effect? Yes, but I think we'll continue to strive well in this area for that. Okay, so what this is, and again, this is complicated, but I do want to show you, is that, so the Center for Medicare and Medicaid Services, this is a deficiency grid. So basically all these letters are what we would call a tag or a deficiency. And so they're associated with points. The way that the points works goes from, left to right, if you will, up to down. So at the bottom being a level 1 where there's no actual harm with a potential for a minimal harm, up to level 4 where it's immediate jeopardy to resident health or safety, and then it goes in scope from isolated to widespread. Okay, so you can see tag D is 4 points, and a widespread, L is 100 points, which, obviously the goal with this point system is to get a 0. Okay, this will be relevant. When I talk about how the star system works later, it's based off of points in this factor. So just wanted to, again, an overview. I know this is complicated. I'm going fairly quick, but just giving you a rundown here. So jumping into our initial survey in April, this was, the purpose of the survey was to assess compliance with federal regulations. The previous survey from this one was in November of 2021. So it had been, since then until for them to come in and do a standard survey. Based off of the deficiency grid, we did receive 13 tags in the level 2, which is a no actual harm with the potential for more than minimal harm that is not immediate jeopardy. So these are things that could have been documentation, could have been what you've seen, you'll see it on here, what these items are. But essentially, they found these where there was no harm, but there could be harm based off of what they found. We did, however, have one tag, the G tag, that essentially kicked off this whole run. And just a moment on that, and so there are some details to this because of HIPAA, but in an overview, what I can say, and as they share on here, because it's a level 3, that means that they're coming back for a revisit. So that one tag says, okay, because there was actual harm, we have to come back and do another visit. Just a little bit about that one tag, and facts are facts, So they hadn't been here since 2021, the inspectors. The Saturday before the Monday that the inspectors came, a private companion in the boarding center chose to move a resident when they should not have. They did not ask our team members to do this. This was a privately paid companion that the family, still kept after all of this, but when the person attempted to move them, the resident fell and had a fracture. Now that's a major, injury with a fracture, which, we reported, we did our due diligence. The problem with how it became Kendall at Lexington's tag was because there was an oversight where, we had seen this private companion working at our community since 2019, and we did not have the documentation that that the individual had a background check, and the orientation process for a companion. So because we did not have that paperwork that, said this person is okay to be in our community, that's why we, got this deficiency. Tough one to take, but we did, and, we're better for it in the long run, because now every single companion that you see, here is, has gone through this process. So we definitely crossed all T's and dotted all I's, and we'll continue to do so for that. But just so you know, this was not a Kendall employee injuring a resident of ours. Just, I think that's important to state. So let's continue on. So one other thing, and again, I think it speaks to the timeline. We can go into more details at whatever pace you want after this, but in my experience of being a healthcare administrator, the normal turnaround time from when you have an inspection to when you receive what is called the 2567, which is what's on the CMS website, is approximately 10 days, okay? When they came in April, there was 5 inspectors. 2 were the main inspectors who had been to Kendall before, and then 3 trainees. Now, I don't know what happened or in between there, but sometime between April and June, the 2 main surveyors resigned from the state. So I don't know how that aligned with the feedback there, but there was delays in response. So we got our 2567. We sat throughout the whole month of May in limbo, if you will, waiting on the state's response. These are facts. So we get our response, we have the plan of correction, they come back in June. Now, when they come back in June, they're not just doing a, hey, did you fix the problems that we found on here? It's a whole new inspection with the 3 new inspectors that were here, in April. So now, when we did that, we did receive some deficiencies, 7 total. You may have read in the Advocate, 11.9, deficiencies is the average in Virginia of a CMS report. So 7, if you've worked in this industry, that would be a win if this were the first survey. Because with this survey, there's no revisit survey, there's no actual harm. They just said, fix this stuff, come up with a plan of correction, we'll do an offsite review, which is what they did between this survey and the October one. Now, again, look at the timeline. It took from June to October for them to respond. But we had everything. We sent them all the information after the June survey. So you can see, you can go to the official report that they say, yes, Kendall at Lexington is back in compliance as of July 23rd to 2024. And they even verified on there, resident safety, infection prevention, med management, and care. So it was a challenging kind of limbo time, because we're doing what we ourselves observe, but then we're waiting on their official, documentation to say, okay, what is exactly that you're going to tell us to do, which is, part of the inspection process. So then with the October 9th, revisit, this is our thing. We had 0 deficiencies on it. Fully compliant, have been done. So then the way that the star rating works, it's a delayed system. And so, the 2-star didn't come out until December. And I'll just talk quickly about that. So the CMS 5-star rating, it's not, when you hear the overall star rating, it is not a 1/3, 1/3, 1/3 distribution. It's weighted differently. So health inspections are 58% of the overall star, staffing 23%, quality measures 19%. Within the health inspection, there's 3 different cycles that are weighted differently. So our most recent April survey is weighted at 50%, followed by a 2021 survey at 30%, and then even a 2019 survey at 20%. So the survey that we most recently had, when we get our next inspection, we'll move down to cycle 2 and then following as it continues. And health inspections are at any time. They could walk through the door today or as you see, it could be 3 years from now. We have no say on that. That is up to the state, up to, how they want to go through it. Staffing, that's updated quarterly, but it's also behind. So, for example, in February of this month or this year, I will be submitting our data of October through December. So it's delayed. And then, but quality measures are updated monthly, which is good. So there's that. We'll get into questions, but so where we are today with the 5-star rating. So as of this is December, the December rating overall, we have a 2-star, and that's because our health inspection brought us down to 2 stars. Staffing 4 stars, and quality measures 4 stars. Now we can move out of a overall 2-star into a 3 or a 4-star before our next health inspection. The ways we can do that is either raising the staffing or quality measures to a 5-star, which would mean moving our overall to a 3. And if we're able to achieve both 5 stars in those 2 categories, we can move up to a 4. We can't get to a 5-star until we have another health inspection. Once we have another health inspection, our goal, and I was talking about those points earlier on that earlier grid, our goal is to have less than 57 points. Obviously, our goal is 0, but in order to get a 3-star on the health inspection, get out of that 2, we have to have less than 57 points. Okay, and then once we're at a 3-star, you can get to a 5-star in the overall through the other ways that I just said. Our focus areas, just to be very specific, for quality measures, we have through our QAPI goals, our quality assurance performance improvements, we're looking at measures and trying to achieve 5 stars in that way. Optimizing our schedules and reducing turnover. Just facts. Again, facts. Staffing. We're still being penalized for administrator turnover. I've been here for over a year, and we're still getting, because the way that they hold on to that administrator is for 6 quarters. So we'll still be holding on to a penalty that happened, way back when during that transition. Now there are other factors, and we're striving to have that. As I mentioned, we had a number of our nursing team leave to go to school, they'll be coming back. So we're constantly trying to achieve that. And then again, for our focus areas of the health inspection, this sheet that I keep referencing will tell you exactly specifically what we're doing per line item. However, we're continuously doing mock audits. We're using outside vendors such as FSA that Felicia mentioned. They're coming in March to let us know how we're doing. We have various committees that keep us updated, but we're striving to do our best. So just a quick a couple of thank you. So again, just want to let you all know how important I know the survey results, how important quality of care is for Borden, obviously Webster as well. I do want to let you know that I met with members of the board. I've met with our resident council. I've met with individuals. Thank you all for giving me feedback, in preparation for this meeting. I've met with our health services team who's hanging on back there. They haven't left me yet. And Anita for helping out with PowerPoint. It was good. And so I'll open the field for any questions. It's 11:01 right now. I don't know if anybody wants to pass the mic or Barbara. Yeah.
Just wanted to say to everybody, I live, wait till we get.
I don't know where that one went.
Oh, please stop. Please stop. Wait, please stop.
Feast or famine.
Good morning. closer.
Good morning. I just want to tell everybody, my name's Barbara Kathy. I live here. My husband and I were admitted here. A couple, I say admitted, because that's another. I have almost a 40-year experience in nursing in Virginia, most of it in Virginia, at most all types. Started in the night shift at Stonewall Jackson in 1969, and stayed there a while. And then I went over to Buena Vista and got my administrator's license, and I've been an administrator for many years. I want to say, in general, I don't go and tell him what to do or how to do it. I haven't never done that. I've been a consultant. I walk through his unit frequently. I don't see things that make me blink. I see staff that takes good care of patients. My husband was here during COVID. He had COPD and a fractured hip. And they put him in isolation. The doctor said COVID would kill him. He didn't get a fever. He got excellent care, and he came back home for a couple of years. So I can testify over experience through visiting that this is a pretty good place. I just wouldn't be here if it weren't. And I just wanted to reassure those who have doubts, please come and talk to him. He knows a bunch. He's pretty sharp. And he's taught me a thing or two. So I don't want to mess in his business. But I just want to reinforce this report is not all that we are, or he is, or his building is, or his folks are. There's a pretty good crew back there. And it's very, very, very hard to keep nurses anywhere. If they don't want to come, they want to go, they have young children. We have huge turnover in registered nurses, and they're precious, every one of them. So we're okay here. Thank you.
Anybody else have a question or concern? Or remember that Adam is available if something occurs to you later. Otherwise, I guess we don't know.
I was too busy learning.